let's and if I make it so, if I make it full screen and then I go back and share the full screen with you. Now you can see the full screen slide, right?
Yes, ma'am.
So we have just drawn the similar table, and now we are going to listen to the doctors. They describe the three patients, Mr. Jones, Miss Rigby, and Mr. Dixon, and we should make notes about each patient, about their appearance, eye contact, manner, mode of speech, insight, and doctor's feelings, what they feel after they met this patient. Do we understand what insight means here in this context? Insight means whether the patient understands that he or she has some problems. So this is the meaning of insight. Well, now I'm going to just switch on the recording and you'll tell me if you can hear.
Unit 9. Listening.
Can you hear?
Yes, ma'am.
Yes, ma'am.
Okay, now from the beginning.
Unit 9. Listening. 1.
Mr. Jones had the appearance of self-neglect. He did not appear to be paying attention to what was being said. He looked as if he had withdrawn completely from his surroundings and was preoccupied with his own thoughts, with no eye contact whatsoever. He sat hugging himself during the interview. He did not interact much with the nurse, nor look at anyone else. He left me feeling in quite a low mood myself.
2.
Although Miss Rigby is in her late 40s, she wears really bright clothes, which are suitable for someone much younger. When she was admitted, she was in a highly elevated mood, hyperactive, and was awake all night. Her thoughts are all over the place. She did not appear to be aware of anything abnormal in her behaviour.
3.
Mr. Dixon was well dressed, but looked very worried and anxious. He sat on the edge of the chair, was quite agitated, and couldn't sit still. He was fidgeting all the time and had very poor concentration, though he looked at me when he spoke and was spoken to. I felt safe with him, but a bit nervous after the interview.
And let us listen for the first time just to be sure that we understand all the details.
Unit 9. Listening. 1.
Mr. Jones had the appearance of self-neglect. He did not appear to be paying attention to what was being said. He looked as if he had withdrawn completely from his surroundings and was preoccupied with his own thoughts, with no eye contact whatsoever. He sat hugging himself during the interview. He did not interact much with the nurse, nor look at anyone else. He left me feeling in quite a low mood myself.
2.
Although Miss Rigby is in her late 40s, she wears really bright clothes, which are suitable for someone much younger. When she was admitted, she was in a highly elevated mood, hyperactive, and was awake all night. Her thoughts are all over the place. She did not appear to be aware of anything abnormal in her behaviour.
3.
Mr. Dixon was well dressed, but looked very worried and anxious. He sat on the edge of the chair, was quite agitated, and couldn't sit still. He was fidgeting all the time and had very poor concentration, though he looked at me when he spoke and was spoken to. I felt safe with him, but a bit nervous after the interview.
Well, let us summarize what we've learned about these people, about Mr. Jones, and let us listen to Vidya.
Yes,
So,
ma'am.
what have we learned about Mr. Jones?
Mr. Jones' appearance was, by looking at his appearance, you can say he's self-neglected, careless,
Mhm. So what else?
and he'd not give any eye contact.
Mhm. Well,
And
so what about his manner? How did he behave? Who can help us without
He
about?
was
No
with
interaction.
no interaction with the nurse, and self-hugging.
hugging him.
Hugging himself. Mhm.
Preoccupied with his thoughts.
Exactly. Mhm. What about doctor's feelings?
Quite low mood.
Quite alone mode.
In a low mood. Yes, that was what the doctor felt after the meeting. Okay, now Miss Rigby, let us listen to, is Lahari here? Lahari is absent. Rohita,
Yes, ma'am.
what have you learned about Miss Rigby? Mhm. How was she look like? How did she look like? What kind of dress did she wear? Who can help us?
She is like in 40s and she wore bright clothes. She looks much younger.
For much young people.
Okay, something which was just made for someone much younger. Okay, what about her mood?
It was
Highly elevated and hyperactive.
Mm,
No abnormalities.
okay, and the inside?
She's not aware of
He's not aware of
Aware of.
her abnormal behavior.
Mhm, of her abnormal behavior. Okay.
She was awake all night.
Mhm, mhm. Now, Mr. Dixon, Bhuvanesh, please. Bhuvanesh? Hello? Bhuvanesh? No, Bhuvanesh? So, Bhargavi, what do you remember about him?
Yes, ma'am. He's well dressed, and he could not sit still,
Mhm, mhm.
and he's worried and anxious. And yeah, he gave an eye contact to the doctor,
Okay.
Yeah.
and he was fidgeting all the
Mhm.
time. And the doctor's feeling is it was safe, but she was nervous.
Yes, the doctor felt nervous after the meeting. Yes, and so if we just speak about the conditions of these people,
Unit 9.
what is likely diagnosis in each case? In the first one with the
He is depressed.
Yes, this is depression. Miss Rigby,
Mania.
mania, right? And Mr. Dixon,
Anxiety.
anxiety, anxious behavior, anxiety, right? Okay, so these are the most common just psychiatric disorders described here in these cases. Well, and now we are going to read about Dr. Tom Turner, so psychiatrist, psychotherapist. And so he's speaking about important skills that psychiatrists, doctors need in their practice, psychiatry practice. And there are 8 skills described here, and we should try and predict which 5 skills will be mentioned by Dr. Turner. Choose only 5 out of 8. So which seem just to be more important in the doctor's practice.
Listening to patient, I think was the one.
Listening, okay.
And developing patient's
the
trust.
Trust. What else?
Speaking clearly and carefully.
Speaking clearly and carefully. I think it's important. 3. Yes.
Stopping oneself from making judgments about the patient.
Yes, it's important to just not to make judgments. 4, and one more.
Being proficient in psychotherapy.
In psychotherapy. Okay, so this is our opinion, what we think is important in the psychiatric practice. And now we are going to read what Dr. Tom Turner says about his job. So let us read this article, and the first person to read it will be Sohita.
Yes, ma'am. My name is Dr. Tom Turner, and I've been asked many times why I chose psychiatry. I had chosen a period in A&E for my next undergraduate rotation when an opportunity to work on a psychiatric ward came up, and it seemed like an interesting option. So it wasn't something I had planned for a long time.
So this is about how it happened that he worked here in this profession. Is Afnan here?
Yes, ma'am.
So read the second part, please.
Dr. Tom Turner. Now I work as a locum psychiatrist, which fits in perfectly with my lifestyle. I have followed a range of courses and training in various areas of psychotherapy and cognitive behavioral therapy and so on. But the most important skills I think I have learned and that have carried me through these years are those emphasized in my internship by my mentor and which still hold true today.
Now he starts speaking about the skills. And so here they are. And let us listen to Khadija.
Yes, ma'am. First of all, there is being able to allow time to help in the healing process for the patient, the family, and the doctor. Coming from the hectic life of my previous department, I now seem to be moving in another dimension. I soon found that impatience was not going to help me or the patients, and that the whole process began with the first contact through to discharge from a ward.
So this is about changing his attitude to time. Well, and the next part is for Mayuka.
Listening is another but no less valuable skill. I had of course done a lot in my training, but working on the word what impressed upon me that effect on the patient of just having someone talking time to listen. And though this came trust, being non-judgmental as we listen to patients is another important technique, as otherwise there is a danger of patients alienation. Finally, there is the ability to use our skills of daily living which we can reteach to patients as they prepare for discharge.
So there is a word alienation. Do we understand the meaning?
I think being outcasted, like separated,
yes,
isolated, or
isolation. It originates from alien, right?
Yes.
Okay, so this is the information about the skills that are important in the psychiatric practice, and So the same list of skills, and which 5 skills are mentioned by the doctor. So what are the skills? So first he was speaking about what?
Listening to patient.
Listening, yes. And first he was speaking about time. Letting time run its
Letting time
course.
run its course.
Yes. Okay, what else? Listening.
Knowing how to use one's own daily life skills.
Yes, it's also
In their
important
daily
in the
life.
psychiatric practice, just to teach the patients how to do this. And 2 more. What else?
Developing the patient's trust.
Developing patience.
Yes, exactly. Yes, exactly. And one more skill he was speaking about.
Stopping oneself from making judgments about the
Judgment
patient.
of the patient.
Yes. So these are the most important skills in his practice. And so let us focus on some grammar issues. This is the use of the past tenses. The use of the past simple and the past perfect tenses. In the conversation, what in the article, the Dr. Turner says, I had chosen a period of A&D for my next undergraduate rotation when an opportunity to work on a psychiatric ward came up. So we can see here, I highlighted the forms of 2 verbs, had chosen and came up. So the first is used in the past perfect tense, and came up, this is the past simple tense. And if we compare these 2 actions, we can see that so had chosen happened before before came up. So this is the previous action. The same is with the second example. The doctor says it wasn't something I had planned for a long time. So one of the actions wasn't in the past, and the action which happened before had planned, it is used in the past perfect tense. So but the rule, we use the past simple and the past perfect to describe an event or period which happened before a point or period in the past. And here is some more detailed information about the present perfect tense form. It is formed with the help of an auxiliary had and the past participle of the main verb. If it is, for example, irregular verb, this is the third form of regular, for example, had written, had done, had spoken. When do we use the past perfect tense? The past perfect takes place before another past action. Like in the example, I noticed that he had left his books behind. So I noticed it happened in the past, but he had left the books before I noticed this. So had left happened earlier. So this is how can we imagine this on the timeline when we speak about the past events. Something which happened in the past can be described with the help of simple past, and something which happened before this action is described with the help of the past perfect tense. And so there are some expressions commonly used with the verbs in the past perfect tense, like in the example, after I had eaten, I returned to work. So after is commonly used. Or the shift was over by the time I had written up the notes by the time here. Or I had already left the ward when he arrived. Here we can use already with the past perfect tense. I fell asleep before I had finished studying, also before. And once I'd finished washing my hands, I was ready to begin. So once I had done something, I did another action. Well, and now let us look at the sentences here, and we should complete them by putting the verbs in the correct tense. One of the verbs should be used in the past simple and one should be used in the past perfect tense. If we have a look at the first sentence, it says, Dr. Glover already finished his ward rounds when the consultant phoned. So we need to understand which action happened first and which action happened then. So finish or telephone, what was the first?
Finished would be, I think, past.
Finished.
Yes, and used in the past perfect. So Dr. Glover had already finished
Finished his
rounds
ward
when the
round.
consultant
When the consultant
phoned.
phoned.
Yes, this is the past simple. When the consultant phoned. So please look at the other sentences and just I'll give you 3 minutes to use all the verbs in the correct form, past simple or present perfect. So 3 minutes for you. Start, please. Well, so let us listen to is Rina here? No. Well, let us listen to Bhargavi. So the second sentence, please.
The doctor rushed to the ward, but the patient already disappeared.
So where is the past perfect?
Past perfect. Past perfect, I guess, disappeared.
So use it.
The patient already is.
Before
the patient
disappeared.
We don't need here to add any words, but we need to change the form of disappear, and the past perfect.
Disappeared.
The past perfect of is formed with the help of had, and the main form should be used in the past participle. So,
Had disappeared.
but the patient had already disappeared.
Already disappeared.
Yes, and rush should be rushed because this is past simple. Okay. Well, the next one is for Vidya.
Yes, ma'am.
Number 2.
I do
Number 3.
assessment before, so I know what to do.
So,
Past,
do. What form should we use do?
I did some assessment tests before, so I had known what to do.
We should compare these two actions. And which of them happened earlier? So what did I do before?
I did some assessment tests
So
before.
it should be using the past perfect. The action which happened earlier should be expressed with the help of the past perfect tense. So it is I had done
Some assessment tests before, so I knew what to do.
Exactly. Okay, is Lahari here? No. Rohita, please.
Yes, ma'am. Mr. Scott be well known to the police. They arrest her once before and bring her to the hospital.
What happened first?
Mr. Scott had be well known.
Look, before arrest, yes, arrest is this was done before being well known. That is why we need to use arrest in the past perfect tense. And be should be used in the past simple. So Mrs. Scott was well known to the police. So they had arrested her once before and had brought her to the hospital.
To the hospital.
Okay. Well, the next is Sohita.
Yes, ma'am. Have you made up your mind about your future career when you were at secondary school?
Exactly, you are right. Had you made your mind? So this is the past perfect. Okay, the next is for Afnan.
Yes, ma'am. He finished his internship by the time he finished his home country. He left his internship by the time he didn't complete his home country.
Look, so
he didn't complete his internship by the time he left his home country, ma'am.
What happened first? Completing internship or leaving his home country? Completing internship, right?
No.
So it should be used in the past perfect tense. He hadn't completed. By the time he left his home country, okay? Khadija, please.
Yes, ma'am. In 1960, a year after Roche first synthesized diazepam, Roche, along with Merck and Lundbeck, introduced amitriptyline to the market. In 1960, a year after Roche had made diazepam or made
Had first synthesized
diazepam, Roche, along with Merck and Lundbeck, introduced.
You are right. Okay, yes. This is the way we should use the past simple and the past perfect tenses. And so now we are going to read the article How to Elicit the history from people with psychiatric disorders. And I would like just who will be the next to read it? It will be Mayuka, please.
Yes, ma'am. Introduce yourself, explain it to the patients how long the interview will take, and explain its purpose. Find out how the patient came to be referred and what his expectations are. Example about treatment. If the patient denies having any problem or is reluctant to talk about himself, do not hurry him. Try asking, how are you? What have been happened to you? What are the most important things? Another approach for hospital patients is to indicate why the GP referred the patient and then ask what the patient thinks about this. Sit back and listen without interrupting. Notice exact examples of what the patient is saying. Take more control after about 3 minutes to cover the following topics.
Mhm. So it reminds us just the same skills that Dr. Turner was speaking about, just listening and taking your time. The essential skills in psychiatric practice. And now let us listen to Bhargavi. This is the next part of the story.
Yes, presenting symptoms. Agree a problem list with the patient early and be sure it is comprehensive. Example, by asking if we were able to deal with all these, would things then be all right? Or if I were to help you, I were to help you. How would the things be different? Then take each problem in turn and find out about the onset, the duration, the effects on the patient's life and family, events coinciding with the onset, the solution tried, reasons why they failed. The next step is to inquire about moods and beliefs during the last week. This is the different. This is different from the mental state examination, which refers to mental state at the time of interview.
You see, there is the idea about asking questions according to the Socrates model we were speaking about previously, about onset, duration, and other questions. So the next piece of information is for Vidya.
Yes, ma'am. Specifically check for suicidal thoughts, plans, or actions. The more specific these are, the greater the danger. Discussing suicide does not increase the danger. Depression, it means low mood, anhedonia, unable to feel pleasure, self-denigration, I'm worthless. Oh, I wish I had not been born. Guilt, it's all my fault. Lack of interest in hobbies and friends, plus biological markers of depression, early morning walking, decreased appetite and sexual activity, weight loss, mania, symptoms of psychosis, persecutory beliefs, delicious hallucinations, drug and alcohol use, obsessional thoughts, anxiety, eating disorders. Example, young women, often not volunteered and important, not compulsive behavior. Example, excessive hand washing.
So these are the symptoms and signs of these most common disorders. Well, yes, and we have a couple of minutes to discuss what we should do next. This is during the next hour, we should deal with the midterm 3 test, and we can find it on the Moodle site. And it summarizes what we've learned during the last 5 weeks. And well, there are 22 questions in this test, and there are of 3 different types. Just true-false questions. You choose, you read the statement and you choose one of the options. Matching questions, for example, there are words, terms, and definitions for them. You should match them. And select missing words. It means you'll see the short text and with several gaps in this text, and then you can see the several options for each gap, and you should choose the best one. And so don't forget to click save. And yes, it's important that the time for the test is 30 minutes. And then you shouldn't miss it, the test, because the test will close automatically. I'll open access to this test now, and it will be accessible for 1 hour. But you should start the earlier the better, because in an hour, if it will just be shut, in an hour it will close. You see? Well, that is all so for today, and